virus, Italy is tightening the screw to avoid a restart of the pandemic. Rome, Italy on Tuesday announced new restrictive measures in public and private space aimed at controlling the resurgence of the pandemic in a country that has more than 36,000 dead. The decree, signed by Prime Minister Giuseppe Conte for 30 days, notably prohibits bars and restaurants from serving customers who are not seated after 9 p.m. local time. It prohibits parties and celebrations both outdoors and in closed places and limits the number of guests at home to 6. Italy recorded 5,901 new cases on Tuesday, a number more seen since April, but which seems more or less stabilized and much lower than the rates of contamination observed, for example, in France or Spain. We must avoid subjecting our country to a new general lockdown, Prime Minister Giuseppe Conte summed up during a press briefing at the seat of government. The general containment imposed in the spring had indeed weighed on the activity of the third largest economy in the Eurozone. The decree was negotiated with the regions, directly responsible for health management, but the head of government did not rule out taking even more coercive measures in the future if the situation continued to deteriorate. Contact sports between friends and school trips are also prohibited for a month. Weddings and baptisms cannot accommodate more than 30 people. We will not send the police to private homes, but we must adopt careful behavior to manage the current phase and avoid dangerous situations, said the Prime Minister. As of last week, the wearing of a mask, already widely respected, was made compulsory throughout the country, including outside. At the same time, Italy has also relaxed its health protocol linked to the quarantine of contact cases and the isolation of positive cases. Until now, if you test positive, the rule has been to impose 14 days of isolation and 2 negative tests at the end of that period in order to be released. Now the quarantine will be 10 days, of which the last 3 are symptom-free for symptomatic people, and a single negative test will be enough to establish that a person is cured.